Thank you so much for joining us this afternoon for another one of our frontline conversations with people involved in responding to COVID, and now people involved in responding to the righteous unrest that we've seen across the country over the last couple of weeks. So first, I always start off with how are you doing personally? How are things going? How's your family?
Thank you, Doug, so much. It's great to be here with you all today too. And I see so many friends out there. So I'm doing well personally. Things are very busy, have been extremely busy, and everyone's using the word unprecedented during this time. And I would just say it's been historical. But overall doing great. And it's good to see you, Doug. And how are you?
I'm doing well, thank you.
Good. Did you have a nice weekend?
You're the first one to ask me how I'm doing at these conversations. Yeah. Very nice. I'm actually up in Cape Cod till tomorrow. I'm coming back tomorrow. So.
Oh, I love that. You can't be doing better than that.
It's beautiful weather up here. So
great.
So talking about the unrest that we've seen, I know you all have done some things at the hospital to help address that and have your doctors involved. So how about can you talk to us about that a little bit?
Yeah, absolutely. So I think, first and foremost, this is and should be a watershed moment for our entire country in terms of the injustice, the brutal killing, and really murder of Black men and women in this country. It's an inflection point that I will hope that everyone will take a step away and personally reflect on their own views about racism, about inequalities, and what we as a country need to do differently. About 2 weeks ago, I think when this all first started to unfold and the country was up in arms as they should be, Children's National, we took a step forward with our CEO's leadership, Dr. Kurt Newman, and have held special town hall meetings, really opening up the conversation for all of our staff around racism and the injustice and the brutal killing, in particular of George Floyd, but all of those who have gone before him and certainly now after him as well. So we've created that opportunity for our staff to really start to, for us to acknowledge the pain, the anger, and the grief of our employees, but for our staff to also express their concerns around racial injustice. And it's been one of those, it's difficult conversation, but it's been a long time coming for many years. So just having that conversation and opening up, and as a leadership team under Dr. Newman's leadership, listening. So listening and then learning about what we can do different as an organization, but also then how we can act. I think as an organization at Children's National for years, we have been addressing a lot of this systemic bias that impact, in particular, children and their families and their well-being of patients. So we are celebrating our 150th birthday this year. So imagine that 150 years ago, post-Civil War, Children's National was born on 13th and F, a 12-bed row house to care for those children who were most vulnerable and could not care for themselves. So those were children that were orphaned, those were children that needed significant health care, and children that had no place to go, and we opened our doors. So for a long time, we've been serving our community in that way, in a very compassionate way. But we've also known of more recent that, that it is the traumatic instances of racism and the trauma that can really impact a child's life, and particularly those children of minorities, and particularly those children of color. And some of our own researchers, we have many researchers here, Doug, who have published on and highlighted how racism is driving significant health inequities for children, and also the adolescents and their families. So we will continue to study this, to research it, and act. We have an active group of under the leadership of one of our LGW leaders, Tanya Kinlow. She is over government and community relations, and she's doing a lot in our community to support this work and representing children as well, as is Taurine Creppy. I think Taurine is on in the chat room now, where she's one of our participants, and she heads up Safe Kids, and that's another one of our advocacy efforts to make sure that all children their needs are met, but most importantly, those that are the most vulnerable and those that are minorities. So a lot more to do in this space, and we're taking it seriously, and we're listening, we're learning, and we're acting.
So we had Michael Amilcar on from Cook Ross earlier, and when I asked her how she was doing, she said not well. As a person of color, she's very distraught over what she's seeing, not just today, but over the history of her life. And in your town halls, what are you hearing from some of your staff that are working there? What are they telling you?
So Doug, that's a great question. And what we've been hearing from is some of our leadership members, Dr. Denise Bramble, she's our chief medical officer. And she has shared with us that, she's talking about the invisible backpack that a Black woman or a Black man or a minority carries with them. I think that was certainly an aha for some of us, and certainly for me, in a real way, in a transparent way. And so how can we think about helping unpack that backpack, invisible backpack that, people of color or Blacks carry around? And how do we help them with that? And so just listening, I think, is really, really critical. The other thing we've heard about is that, in some of our areas at Children's National, we represent a very diverse group. And 38% of our community or staff are Black, 35% are white, 11% are Latino, and 9% are Asian. So of our 8,000 employees, and we're almost the second largest employer next to the federal government in the District of Columbia, we are very well represented. But do our policies and our actions always follow with where they need to be to support our minorities? And that's something we're taking a look at. But the other, I think people also want more action. They want a stronger diversity and inclusion committee. And then they want, of course, action and policy change at the national and federal level.
So I saw some pictures of doctors outside of Children's Hospital. You can tell us what that was all about.
Thank you for, yes, it was a very important day for us. That was a week ago Friday. Dr. Denise Bramble, who is our Chief Diversity and Inclusion Officer here at Children's National, along with Daryl Barnadoe, who's our Chief People Officer. But she led a group, it was White Coats for Black Lives. And it was our physicians who donned their white coats and went out to the front of the building, all socially distant. So being the chief operating officer, we made sure that we followed the rules, but it was powerful. Wow. And we probably had over, I guess, maybe 400 or 500 of our physicians, of our 900 physicians, participate in that, whether it be at Children's National or in Montgomery County at our Rockville site, and some of our other smaller regional outpatient centers. Very, very powerful, made a huge statement. And I wished I could share with you the pictures because it really was incredible.
I did see some of them. It was very powerful. So congratulations, Chief.
Made a statement around our stance and stamping out and eradicating racism and focusing on the social justice that our country needs. And that, it all starts really with an individual, right? It all starts individually, and then you build that out as a leader into your community.
So we talked about being able to say that you're not doing well, and that's difficult for a lot of people. How are you getting your people, to your staff, to open up and say, this is not working for me?
Yeah.
And feel that, have the courage and feel the support to be able to do that?
So it's a great question. There's a couple of ways we're doing that. We're allowing the staff to just open up, and we've offered additional psychological support or psychology support for our teams through our employee assistance program. So we want to make sure that not only through what we might call the pandemic racism that's going on. We are dealing with the pandemic of COVID, but also, how do we help and keep our staff mentally healthy? These are very tough, very trying times. It was enough to manage through the COVID-19 or be managing through COVID-19, but also to now address that we've needed to for so long, the issue of racism. So making sure that staff feel supported, making sure that they have an open door. I have given my staff personally, you have my permission. You have my permission to come talk to me about what you're feeling, what you're concerned about. You have my permission to say, as a white woman of privilege, did I say something that might have offended you or a group? Because I would want to know that. So, just having that permission for staff to be able to open up. And then connecting with staff. We've had several town hall meetings that have started at our leadership level with our CEO, then with our executive team. And then we've pushed that down into the organization so that I am meeting with our frontline EVS workers who, 90% are a minority. And so making sure that they feel safe, that they can speak out, and giving them a voice as well. So those are all things we're doing, but I will tell you, not everybody is ready to talk about this. And some people feel like, well, is this going to be a flash in the pan? Is this going to be something that that we're not going to act on? But we've made a commitment, at least here at Children's National, that no, we are committed and we're going to make change. And we want to be part of that change. And we want our frontline staff to be part of that change.
It's a very difficult time for people because you got COVID, you have the economic recession, if not depression. You've got this righteous unrest throughout the country and the world. You've got climate change, which is still going on. So there's all kinds of upheaval, disruption happening all around us. Yeah. And it's as you said, very critical to look after people's mental health and help them sort of adjust through that and as best they can. But it's a very, very different kind of time, I think, than any other period in my life.
I think it's a very interesting time. And actually over the weekend, I was reading a lot about President Lincoln and what kind of leader he was and how he led through some very trying times. I mean, they had pandemics. Of course, they had the Civil War was huge. And just his continued fight and his continued leadership for equality and how he really didn't give up until the end, of course. But he, just learning, I think, from different leaders in our historical time, it is quite telling. And so I picked up a little, it was a Cliff Notes on Lincoln because I don't always have a lot of time, but it was a great little read. And I learned a lot around thinking about then how do you internalize that as a leader, but how do you then lead forth? Because during this time of crisis that we're all experiencing in our own organization, never before has leadership been more important. The leadership visibility, how you respond, how you hear and listen from your staff, and how you change and make change. I have learned so much and have so much more to learn, but I think that how we respond as an organization and then certainly as a country is going to make a huge difference, Doug.
I do think that the groups, the people, the organizations that are going to succeed through all of this upheaval are ones who practice inclusive leadership. Mm-hmm. You talked about listening to the people you work with, doing these town halls, reaching out to people, trying to get input, as opposed to the people who stand back and say, I know it all, here's what we're going to do. I do think that the more inclusive we are, the better we're going to be, because it's not people talk about a new normal. We call it the dynamic normal because it's always changing. The normal is changing every day now. And you've got to adapt. And the only way to successfully do that is through inclusive leadership.
Yeah, I think you are absolutely right. And I think that being humble, there's a lot to say about humble leadership and about servant leadership that would serve a lot of people really well right now in this how we're dealing with issues, because as leaders, we don't always have all the right answers. We don't always have the right responses, but if we can listen to our staff and then try to make the right decisions, and if we don't, make change and change quickly.
Yeah.
But Doug, you led through that. You led through that with the sniper, right? In
Long time ago,
2001.
yeah.
I know it was a long time ago, but those leadership traits come back and they're important.
Let me shift to COVID, although we're not really shifting, because I think if anything showed the systemic racism, the racial inequity that we have in our society, it has been COVID because of the people that it's affected. So I want to talk a little bit about when this came out. How did you at the center handle all this? What did you do with your doctors, nurses, and others? How is it affecting you as a business? And then I really do want to talk some about the children that you deal with and what it seems to be just a horrible impact that some of them are getting from COVID.
Mm-hmm. Yeah, so absolutely, I'll be happy to dive right into that. Well, let me start by saying for many years, Children's National has been on the forefront of responding to emergency crisis from an emergency preparedness perspective. And, back to 9/11, when we had the terrorist attack on the Pentagon and saw just the awful situation there in New York City and Pennsylvania. And then, with that, the leadership at the time then recognized the need to build the foundation for emergency preparedness. And I think maybe even Ray Scudlow might be on the phone. I saw his name here. He was general counsel, part of our leadership before that, the chairman of the board at Children's National in many years before that. But, it's through his insight and the previous leader, Ned Zeckman, as well, to create that foundation. And so with that came appropriation dollars that helped to fund part of our East Tower when we built it in 2007. It was a new facility plan, 150 beds roughly of private rooms. And with that then came appropriation dollars to build out at that time, it was a decontamination unit because we were all worried about what the impact would be from a terrorist attack with decontamination of children. From there, we built that specific unit out, facility side, and then also then went on to address real issues of pandemic or potential of Ebola. And Children's National led the way on that with our medical staff leaders, Dr. Roberta DiBiase, and created an Ebola unit or a special isolation unit. And we were one of the Ebola treatment centers in this country in partnership with NIH, specifically for pediatrics. After Ebola came Zika virus, and then all of that lined up to create the foundation for us being able to address COVID. It was really in late December that we started forming as a steering committee leadership team. I pulled my colleagues together, our two chief medical officers, and to create a structure around COVID to support the work that needed to happen, because we knew that it wasn't if, but when COVID would enter the United States. So we started our planning back in late December, early January, created the foundation, etc. And then our kind of D-Day, so to speak, was March 15th, when we had our first employee test positive for COVID and our first patient test positive for COVID. I'll tell you, as a nurse, as my background, I was actually the person that helped to test the first patient because we didn't have a process set up yet for our employees. And we recognized that was going to be really important. So, coming out on a Sunday and making that happen with our chief medical officer for this individual was really a critical time. We set up testing really early on for COVID. We bought the capital that we needed and invested in that equipment, the machines, et cetera, to be able to test quickly. And so we were able to turn around our COVID tests within 90 minutes, which, as you know, when you get a COVID test now, it can take 3 or 4 days. We're able to do that quickly for our kids. So we recognized real early on, and with our CEO's leadership, that testing was going to be key. So we launched then in a very short time, within 1 week, with our chairman of the board, Jeff Zients, our funders and our foundation, to support this, Scott Nolan and others who were able to support this, and opened up a test site at Trinity that was a drive-by test site just for children. And we were so thankful to Pat McGuire over at Trinity. She's the president. She's just fantastic. My goodness, she opened up her parking lot to us, and we had donors donate tents, and we were able to set up our testing site within a week for pediatrics, which has been extremely helpful, and it was a response to our community and our community physicians. We then kind of settled in a little bit in terms of our what we called our resilience plan.
Kathy,
Yeah.
let me interrupt for a second here. So you started in December, you were in January, you went and got the testing to be able to do it very quickly. You set up a testing center.
Yep.
Where did you get all your information that said we need to do this? I mean, where were you getting information on that? And where was the rest of the world? I mean, again, sitting back as a former elected official, county executive, it's test, 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 test. That's what you got to do. You got to focus on that. And we didn't do that.
We recognized it was a threat. We recognized COVID was going to be a significant threat, and we saw what was happening in Wuhan. We had insight. Our director of infection control, Dr. Shoyan Song, is actually from China. And so she had connections over there that gave her the insight to tell her and then us that this one is bad. We need to pay attention. Could it be a SARS? Could it be a MERS? We didn't know. So that's how we actually got that intelligence to be able to say we needed to act quickly. There were some that were on our leadership team that were probably not as invested, thinking, oh, is this really going to happen? Is it not? But by the time February came around, I think there was significant acknowledgement that yes, this was going to be an issue. So great question. So
you wanted to talk about resiliency.
Yeah. So we created what we call a resilience plan, and the resilience plan was around protecting our staff, and we recognize patient safety is always first. But in this case, the staff and the patient safety were equal, because if our staff weren't healthy to care for the patients, then we couldn't safely care for the patients. So protecting our staff, protecting our patients, and serving our community became our three primary guiding principles in all the decisions that we made. All the way back from in March when we were making decisions around, do we want to allow for international travel? We have a huge research enterprise. We have academics. Our faculty are going all around the world. When would we stop that? Before the federal government stopped it. When would we stop national travel, et cetera? So just some really hard decisions. And how quickly would we telecommute with our staff? So we created this resiliency plan that addressed responding to COVID, to sustaining. And once we hit the sustainability phase, it was about, okay, so we're here for our patients, but they're not necessarily coming because our elective procedures have been eliminated at this point or reduced. And we needed to make sure we're here for our community. And now we're in the recovery phase. But during that time, in the responding, it was, as I mentioned, it was around testing, keeping our staff safe, making sure we had the PPE that was required, making sure that we were doing employee screening, and all of those operational pieces that were so big and so important. So we were focused on strengthening our clinical operations. We were focused on providing support for our community that was so needed, and then protecting the workforce. When we moved into the sustainability phase, we said we needed to continue all of these things, but then also ensure our financial stewardship. Because at that time, when we moved into our kind of respond and sustain phase, we were starting to lose a significant amount of money, around $1 million a day, when our volumes precipitously dropped. Because one of the things about COVID that was thought early on is this is not a disease about kids. They said this is a disease that impacts the elderly, that impacts the most vulnerable, that impacts those adults with comorbidities or with other chronic illness. But what we have learned here at Children's National, it is a disease about kids. And kids do get COVID. Kids do get COVID. They do not get as sick. And that is just has been the silver lining for the kids. But they can be sick for a very short period of time. We're able to really, through our expertise, manage through. And then they bounce right back. And that's what we love about kids, is they are just so incredibly resilient. But so what we've shown to the country and to the international community is that we are probably one of the busier centers that have cared for quite a few COVID kids. So we went through the sustainability phase as we're taking care of the kids, and we've moved in now to the recovery phase. And even though we know that we have to prepare for a surge, and one time the mayor said to us, you need, through Dr. Nesbitt, of course, the Department of Health, we needed to be able to expand our facility to care for about 600 patients, or have 600 beds. We are currently a 323 bed hospital. So operationally, we needed to figure out where we were going to put 600 patients. Well, we went through all those exercises diligently and had a plan. We haven't had to execute it yet, but we also have not entered the second wave of what we believe will be a second wave of COVID. So we're moving forth in the recovery phase as we continue to take care of COVID patients, COVID positive patients, in a very safe way. And also then make sure that those children who have put off their procedures, their visits with their doctors, can and will be seen. We've always been here for them. We quickly shifted our ambulatory visits over to telemedicine in a very rapid way. We're still seeing a lot of patients through telemedicine, but in some cases, telemedicine doesn't cut it. And you actually need that physical examination done by your physician. We have seen kids that have come in because they've waited, or their parents have waited, are much sicker. So they're getting admitted more quickly through the emergency department into, as an inpatient, because they're sicker when they're coming in, they're waiting. So just the same phenomena that we're hearing about adults waiting to kind of hold back on their health care, we've seen that happen with kids. So the message is, if you have children, do not wait. Make sure they're seeing their primary care physicians. Make sure they're getting their immunizations. Make sure that they're getting and addressing all their needs, because this too can pile up and not be good for the kids. So the recovery phase.
Can we talk a little bit about children with COVID and this multi-system inflammatory syndrome that is affecting? You all quickly became a center for children suffering from this, and the cases were being sent to you. How does that? How did you all handle that?
Yeah, that's okay. Great question. So in terms of our COVID patients, when they have been admitted or are admitted, we have a special isolation unit. So as I mentioned, what the previous leadership did in 2007 to build out a special isolation unit, we put that into action. We put that into place. So that's where the majority of our COVID patients who are COVID positive are cared for. We also have a pediatric intensive care unit that we were able to quickly turn into a negative pressure isolation entire unit. So that happened really overnight. And we were able to manage, several intensive care patients there. So that occurred, as well as then our special isolation unit. So we have our doctors, our nurses have been highly trained in the PPE, the donning, the doffing, but also caring for the nuances of how this disease acts. It can be anywhere from a sore throat to a fever to nausea, vomiting, to non-discrete symptoms. Even patients can be asymptomatic. We test every single pre-procedural patient, and some of them are testing positive that have no symptoms. In terms of the MISC, the multi-system inflammatory disease, what we've learned from that is our expert physicians under the leadership of Dr. David Wessel, who's really been leading at the international level on this, we started seeing this MISC, which is inflammatory response to the disease, perhaps about 4 to 6 weeks after the child might have been exposed or had COVID. What we're seeing is that the child may respond from an inflammatory response, so it can inflame the heart, it can inflame the vessels, and or it can inflame different organs. So once we give a drug to reduce that inflammation, the child can really turn around and have a very, very good outcome. At this point to date, we have not had any patients who have died from COVID or from MIS-C. And I knock on wood for that, because of our incredibly expert doctors and nurses working hard to make sure that we're addressing all the patient's needs.
Anna Bard has asked a question about that, but also about recommendations for children going back to school in the fall. What should we be aware of? What should we have for? How do we handle that?
So Anna, that's a great question, and it's good to see that you're out there, my former Sweet 16er. So number one, so the patients, how do we respond? I mean, we have the testing, we have, you need to go to your pediatrician if there's a concern, but going back to school is going to be it's a big question. We have chartered our own internal back to school task force to help the District of Columbia and our surrounding communities, both Prince George's County, Montgomery County, to offer support on what we know and what we think we know about helping the children back to school. Number one, in the District of Columbia, we're going to be making sure that our nurses, our school nurses, because they all do report into Children's National through a contract through the Department of Health, are trained, so that they're trained to look for and identify any symptoms or address any COVID-related illnesses or issues. That's number one. But going back to school, there's going to have to be a whole strategy around social distancing, around eating in the cafeteria, around how do you manage through and disinfect all of the desks, etc. Do kids wear masks? Of course. Do teachers wear masks? Of course. What's the number of kids in a classroom? We have some experts here. Dr. Nathaniel Beers has weighed in on this at the local level and somewhat at the national level as well. And then also Dr. Joelle Simpson is supporting some of the daycare centers to support them in their recommendations as well. We don't have all the answers yet, and certainly that's going to be a big question. It'll probably be a little bit of a testing ground, I think, for us as communities start to open up their schools.
We had a great conversation with Monica Goldson, the CEO of the Prince George's County Public Schools, and something I really hadn't thought of was the school buses, the transportation to the schools. Normally there are 50 to 60 kids on each bus. They're looking, they can get maybe 15 plus on a bus. So how do they, what's the cost of that, and how do they make that work as well? I mean, it's a real challenge.
Yeah, I don't know, but I know that they would have to potentially rotate the kids out. And how do you put 10 children in a classroom when you know there's 30 kids at least in a classroom? So what's the rotation look like? All of that. I think that there are big challenges ahead for our school systems. And certainly we want to be there as a resource and offer support for our schools, particularly being Children's National and being all about kids.
And you said all of the DC public school nurses are employees of Children's.
They are, yes, for the
great.
DC.
I mean, that's impressive. I wish we had done that in Montgomery County. That's very nice.
Yeah, yes. And if you have any influence, we'd be happy to help you with that.
That was a long time ago. But no, I think that's so important, particularly with the population of the schools that we're seeing here. A lot of immigrants, a lot of poverty, people who need that help. That's tremendous, Kathy. Congratulations.
Exactly. Yeah, it's been a great partnership. We've had that contract with the Department of Health for about 20 years now, and it's been a great partnership, and we've really helped to make sure that the nursing practice is strong. And I will tell you that it makes such a difference to have a school nurse in the schools versus a technician or somebody who maybe think, they're trained to put Band-Aids on and maybe give a nebulizer, but it's not the same. So yeah, thank you for recognizing that. And we're very proud of our school nurses. And I will tell you that during this time, the school nurses really stepped forward and they've been testing for the Department of Health. So as you know, school has been out. What do you do with the school nurses? Well, they stepped forward to test and support the testing sites for the Department of Health in the city.
That's tremendous. That's really great news. I'm so glad to hear that. So you're in your recovery phase now. Where do you see this going? I mean, we're starting to see cases pick up again around the country. We're still in the first wave. We haven't hit the second wave yet. So what's your forecast for where we're going with this?
So Doug, you're right on around, we are still in the first wave. And I think people are getting a little bit too comfortable with the first wave and probably letting their guard down. Certainly we see it, with the protest, and I know that's unavoidable, but there's just so many people that are together, and some are wearing their masks and some aren't. So I do think that we're going to see, with that kind of close contact and that close connection, we're going to see an increase. We're already starting to see it a little bit. We measure this very carefully at our testing site. And overall at our testing site, we've tested well over 2,000 children over the last 2 months at that drive-by testing site, and have about a 29% positivity rate. Now, granted, these are kids who come in that are with symptoms. So they're coming with symptoms, but 29% are testing positive. About 2 weeks ago, we started to see the numbers decline. So we hit 1 week where we had a positivity rate of 49%. 50% of the kids, of over 200 kids coming through that a week, were positive. We started to see that decline, and then this week we started to see it go up. So we went down to like 27%. Now we're back up to 35%. So it's, that's on a weekly basis. So I think the message is COVID is here. It is very much in our community. It is very much around us. You can be symptomatic, you can be asymptomatic. That we know that masking and social distancing and washing your hands frequently are all detours of COVID. But it's going to be here for a while. I think all we have to do is hear our renowned Dr. Fauci, who we all love so much. He's just really fantastic. But listening to him, that this is going to be here with us until we get the vaccine. And even once we get the vaccine, the question will be, what is that long-term immunity? One of the things, Doug, that we started doing this week is we're doing serology testing. It's kind of the newer thing around testing, right? You do what they call PCR. So that's when you are testing, are you active for COVID or not? And then serology testing is your blood to say, okay, did I have COVID? Did I have it and didn't know it? And do I have the antibodies for COVID? So we just started doing that serology testing for all of our employees. We're offering that. And we're going to be doing a public health study to determine what percentage of our employees are positive. We're doing that for children too. So for those of you who have children who are interested, talk to your pediatrician, and you can come and get the serology test at Children's National. We'll be happy to help you with that.
We've seen places open up across the country, and there's been a huge push for that. And we've seen the protests and the unrest. We've seen the parties at Lake of the Ozarks and Ocean City and all that. What I'm worried about, you have Governor Cuomo and somebody else talking about, in Houston, they're talking about, we might lock down again. I just don't think that's going to work. Once they've let people out, I don't see how that's going to work. Texas, the philosophy of Texas is basically, you're on your own. It's up to you to keep social distance. It's up to you to wear the mask. It's up to you to make sure you don't get it. Life is going to go back to what it was, and it's very frustrating to see all that happen. But I don't see how the public is going to listen to elected officials or the elected leaders saying go back to lockdown because they've opened up everything already.
Yeah, Doug, I think you're right. I think that the cat is out of the bag, so to speak.
Yes,
literally.
yes.
And people are not going to be tolerant of going back into their homes and being socially isolated. They're just not. I think that we are humans. We're used to socializing. We're used to being out and about, doing our thing. And I don't think that we're going to be able to quarantine people to their homes in the future. So I think that's right. I think the masking, again, masking, social distancing, and washing your hands, or it's all going to be critical. And then eventually the vaccine. We need that vaccine much sooner than later. This is also something that, if you look at, again, history repeats. The Spanish flu. I think we had, at one point, we had the Spanish flu for wave 1 well under control. Well, wave 2 came back with a vengeance. And wave 2 came back in the fall with with not only Spanish flu, but with also the flu and other viruses that were around. So it was much, much more intense. So we really, really do have to be prepared. And although the city has opened, the 500-bed hospital at the convention center for overflow, and all hospitals have been asked to expand and to surge up to what they need to. I hope that we won't need those beds in the fall, but it very well could be that we would.
Well, it's very difficult. So I'll just give you one short, real quick story. My wife and I were out last night sitting on a bench at a beach watching the sunset. And some man approached us and started talking to us and was not wearing a mask. And my wife said, can you please keep your distance. You're getting too close. And he got all ticked off and sort of stormed away. But it's going to take people saying that to other people, and that requires some courage of, hey, don't come into my space. Don't bring that here. So it's very challenging. Kathy, I want to thank you for this. I do want to say, give us some good news. What are some good things that have happened in the last couple of months that you're proud of and you want to share with us?
Well, let's see. We've had so much good news. I will tell you that, number one, the children are getting better. The children are getting better, and we are here for them. We're here for our community. So that's the positive news on the COVID side. I think the other positive news is that we are not only are we here for our community, but tomorrow we'll be sharing some good news about where we are with our rankings in the country. So it's good news. There's good news, good things coming. I think that for us, I think we have to have a sense of optimism for the future. There may be some dark times coming. We must remain optimistic. We must remain solution focused, just like all of those great courses that Leadership Greater Washington taught us. You must lean on each other as colleagues. You must lean into the issues. So those are all positive things that we can take away from this.
So have any LGW members reached out to you to help, or have you leaned on any of them in the last couple of months?
Well, I certainly have on many of them. One of our partners, great partners, John Rockwood, who's a Sweet 16er as well. John and I partnered on how at NRH they needed to make more room for adults. And so we were consolidating all pediatric or regional pediatric patients in the region. So he has a children's unit, it's a rehab unit. And so we transferred those patients over. Also partnering with other CEOs in the city, as well as we expanded our license to care for up to 30-year-old patients. So we expanded to care for young adults. So working with Mike Sackelbaum over at Georgetown and others, and Joe Wright at Prince George's County as well. Joe's LGW as well. And then we have, of course, Children's National has a lot of LGWs that I tap into every day.
That's great. Anything we can do to help? Where do you have a list of resources that we can go to get more information? I don't need to have that now, but we would like to send that out to the people who sign up for this presentation and give them some
I think, thank you, Doug. Thank you. And Leadership Greater Washington is just such an important staple, what I would say, in our community. And the work that you and Debbie and Chase and your entire team do is critical. It reaches so many people. So first of all, thank you to you. And thank you for allowing for this, for us to share our information from Children's. I think I think if we can put resources out for how individuals and organizations can start to address structural racism in their communities, that having a real conversation around that would be excellent. So that is one opportunity. I think also, a link to the CDC website on the COVID side reminding people that, you know, we are not out of this yet. We are still very much in the thick of it. And so addressing, you know, what individuals may need from a CDC perspective, you know, would be important. But I think, and then I would say finally, as, you know, from a leadership perspective, I think the strength of leaders individually now, like I said, has never been more critical. And so each and every one of you, if you're a CEO, if you're leading your company, if you're a middle manager, how you lead and lead through and lead your staff is critically important. Be transparent, be open, be honest, be visible, and understand if you make a mistake, it's okay. And just be transparent about that and go back and change and make the changes that are needed. But Doug, I want to thank you for this opportunity and for all the great work that Leadership Washington is doing.
Kathy, thank you. We're going to take that as your last word for the session. Thank you so much. It's a wonderful conversation. Learned a lot, really enjoyed it, and look forward to continue talking with you over the next few months. So thank you very much, Kathy.
Thank you, Doug.